you ever pictured an ancient Egyptian doctor performing surgery with scalpels, stitches, and even prosthetic limbs? Think this is science fiction? Think again. Today's surgeons still borrow moves from Pharaoh's healers, and what you thought was modern began where the Nile flows. Welcome to Ancient Future. This is the place where history and the future collide. I'm Mark Adam, and together we're exploring how the genius of ancient civilizations literally saves lives in our time. Let's unlock the secrets of ancient Egypt's mind-blowing medical mastery. Close your eyes and imagine. The year is 1500 BCE. On the banks of the Nile, a hub of healing thrives. Priest doctors, wrapped in linen, study scrolls by flickering lamplight. Their papyri? Not dusty myths. Real clinical guides. A battered farmer is carried in, groaning from a broken arm. The Egyptian doctor springs into action. First, a careful look. Swelling, shape, pain. Then, a wooden splint, linen bandage tight, a balm of honey and resin, the world's oldest plaster cast. Here's where it gets incredible. Ancient medical books, the Edwin Smith Papyrus, the Ebers Papyrus, survive to this day. They're written in clear, direct language. Each case goes like this: examination, diagnosis, prognosis, treatment. Let's break that down. Case: a gash to the head. Exam: touch the wound. Is the skull exposed? Diagnosis: if the bone feels sharp, beware. Prognosis: this patient may not survive. Treatment: stitch the cut, bind with linen, apply honey. Short sentences, precise steps, no magic spells, real medicine. Think surgery is new? Ancient Egypt wrote the playbook. Broken bones? Doctors set fractures, aligned them, and immobilized with splints. X-rays? Nope, but experience and touch. The same principles you'd see in a hospital ward. Dislocations? A dislocated jaw? The Edwin Smith Papyrus taught how to push and pull, click the jaw back in place. Shoulder out? Egyptians used a technique that would later be called the Kocher method. Wounds and abscesses. Boils were lanced and drained. Wounds were washed with wine or vinegar, bandaged with honey, nature's own antibiotic. Let us walk into a time machine of medicine. The papyrus describes: setting a femur, splint it, do not allow movement, monitor swelling. Jaw dislocation, slide it back, support with a band. Open abscess, incise, drain a fresh poultice. Head trauma, observe, check for bleeding, look for skull fractures. Sometimes there is hope, sometimes not. You can see their logic. Trial and error. Sometimes recorded as an ailment I will fight with. Sometimes an ailment I will not fight with. This ancient triage. Egyptian medicine tackled hernias too. Ebers Papyrus lays it out. Swelling in the belly? Apply a tight bandage. Rest and manipulate gently. Try to push it back. If swelling stays, heat the area. If all fails, minor surgery was considered. Puncture, drain, sometimes even excision. Isn't it wild? Our modern hernia repairs, keys to so many lives saved, trace back 3,500 years. Let's get hands-on. The Egyptians crafted scalpels out of copper, forceps, bone saws, surgical needles, and even drills. Some of these look modern. If you saw one today, you'd recognize it. They used sharp obsidian knives for fine work. Bandages of linen, soaked in medicines. They even had invention, prosthetic toes, an iron pin in a mummy's knee. Early biomedical engineering, before the term existed. Pain didn't stop them. The Egyptians knew about opium and mandrake. They gave mixtures to dull pain during tough procedures. Honey killed bacteria, proven by science thousands of years later. Bandages weren't just for wrapping. They packed wounds with herbs, honey, resin, nature's pharmacy. Holistic healing, body, mind, and spirit. Medicine for the mind, too. Records show Egyptian doctors treated psychological issues, described as writing troubles or sorrows of the heart. They prescribed rest, rituals, and soothing scents for mental recovery. Ahead of their time, blending body and spirit. Egypt's medical wisdom didn't end at the pyramids. Greek, Roman, and Arab doctors studied these scrolls. Hippocrates, Galen, the fathers of Western medicine, looked to Egypt. Clinical records, step-by-step treatment, surgical technique, even medical specialization, all seeded by ancient Egypt. Let's connect the dots. Doctors still set bones just as Egyptians did. Stitches close wounds. The papyri taught this technique. Hernia repairs? Same anatomical logic. Medical records and follow-up care? Egyptian principle. Cauterization to stop bleeding? Tried and true across millennia. Prosthesis and reconstructive surgery? The legacy continues. Every robotic surgery, every high-tech procedure, starts with the commitment ancient Egyptians wrote in those papyrus lines. To see, to diagnose, to treat. We are the children of the Nile. Every hospital echoes with Egyptian voices guiding today's hands. Surgeons use AI. We build new prosthetics. We heal. And every time we retell Egypt's story. History hasn't ended. It flows, like the river, into our future. Thank you for joining Ancient Future, your source for where the past meets tomorrow. If you were amazed that so many modern surgeries were born in ancient Egypt, hit like, subscribe, and ring the bell for stories you won't hear anywhere else. Which ancient technique do you wish was still used today? Comment below. I want to know. I'm your name, and until next time, never stop searching for the secrets that connect us across centuries, across civilizations.